Okay. All right. So thank you all for attending today's session, which focuses on the nurse practitioner role as a career path. And today we have Kathleen Jay, who is a nurse practitioner who will be speaking to us today. In terms of the format, I'll be asking Kathleen about 5 to 7 questions. And after that, I'll turn it over to the participants to ask any questions that you all might have. In terms of your question asking, I'm totally comfortable with you physically raising your hand, raising your electronic hand, talking, or using the chat. I'm pretty flexible since there's a small group of us here. So let's go ahead and get started. Kathleen, could you move forward with introducing yourself and telling us a little bit about your educational and career path, please?
Sure. So I did my undergrad at Boston College, and I was right out of high school, majored in nursing. It's a 4-year undergraduate program. The first 2 years were core curriculum. BC is a Jesuit school, so a lot of the core curriculum, portions of it were theology and philosophy. And then the second, junior and senior year is really when we did our nursing. You do clinicals, when you're in nursing, you do a range of clinical experiences, and you typically start out with older adults or general medicine. And for me, it was, I think, it's a long time ago. It was the spring of my junior year when I did pediatric nursing at Boston Children's Hospital. I was there for a rotation, and that's when I knew, that's when it clicked for me. So, and I actually started working at Boston Children's in pediatric cardiology in 1989. And I worked there as a staff nurse for 6 years. And while I was working, I went back to BC for grad school and got my master's in pediatric ambulatory nursing. And again, the same experience, a variety of clinical experiences that you sort of have to you do some subspecialty pediatric clinicals and some general, child clinical, in a pediatrician's office. And then I worked for a couple of years in a health clinic in a city in Massachusetts called Brockton, which is about 25 miles south of Boston. And it's a very diverse, working class sort of neighborhood. We were a public health clinic that served a large portion of the immigrant population in the city of Brockton. So I did primary care there. It was a very collaborative environment with great pediatricians and seasoned nurse practitioners. So that was great. And then I went back to the specialty world of Boston Children's, did cardiology, I ran the pacemaker service there for about 3 years. And then I went and worked for cardiac surgery, and really just was fortunate to be able to move around when I sort of felt like I needed to sort of expand skills or do something different as a nurse practitioner. I was in St. Louis for 15 years. We just left St. Louis last August. And I worked, did a lot of teaching clinicals at St. Louis University and Goldfarb School of Nursing, and also worked in cardiology and genetics at St. Louis Children's Hospital. I've been back in Boston since last August, and in St. Louis for 6 years, I ran the Down syndrome program there as a nurse practitioner. And back now, I'm sort of doing a little hybrid of things that I've done for the past 30 years. I'm working in an inherited cardiac arrhythmia program clinic where we see children and families that have heart disease that are inherited or known to be caused by certain genetic mutations. I feel like I've gotten to do a lot of great, wonderful things, and I'm really fortunate about that. And I honestly love nursing. I loved nursing from the first moment I did it. And my mom was a nurse, and her friends thought I was crazy to become a nurse. But I think it's just given me a really wealth of experience. And I've always sort of felt privileged about the way I've gotten to be a part of people's lives, and through my profession. Like I really have felt like that's, I don't know, it's a unique experience, and not everyone gets to have it. So I really love nursing, and I know it's not for everybody, but I think it's changed so much. And I think there's a lot you can do with it if, especially like healthcare is changing. And I think I've been fortunate to see those changes. Sorry, that's me.
Oh, that's awesome. I love that comprehensive journey that you shared with us. Were there any other professions that you considered And if so, or even if not, how did you know that nursing would be a good fit for you?
Well, I mean, I think it's so hard to decide. Like I was 17, like my oldest child is going to college. He's 17. And I look at him and I think, how is he supposed to decide what he's going to do for the rest of his life? And I really, as an adolescent, you know, I really liked being around kids. I really liked taking care of kids. I felt like it was just something that was inherently something I was good at, you know, like as a young person, and I wanted to either teach or be a nurse. And I thought at the time that nursing, not knowing what I could do with nursing, I thought it would give me more flexibility in life with if I had my own family, or I thought it would give me, I thought it afforded me that kind of flexibility that I didn't know if that teaching would. And at the time I thought I wanted that flexibility because I saw my mom who, you know, would work 3 days a week and, you know, still had, you know, was around for us. So, I mean, it sounds like it's probably not a very popular thing to say right now, but in 1985, that's what I was thinking. Like, I thought, oh, this will give me flexibility in my life. So, no, go ahead.
You mentioned that healthcare has changed over time. In what way has it changed since you've been in the profession, and what changes do you see in the future that the students here might encounter?
I think there's, I think like in terms of nursing, I think the role is changed. Like the role is certainly for an advanced practice nurse, the role is changing. Like there's more opportunity to be creative with what you do. You know, in terms of being like, a lot of people will say, oh, like a nurse practitioner is a physician extender, which is really true. Like you function like, typically you function as part of a team with a physician, or, you know, you expand, your role can bridge the gap and do a lot of what they do. But I think what it's changing it, there's more creativity. It's not just, you know, 25 years ago when I became a nurse practitioner, we were sort of filling in the spaces because there was too much work for physicians to do. Like it was a, you know, in my experience, it was a busy inpatient pediatric cardiac surgery service where kids came in for open heart surgery. And, you know, the physicians were training, you know, it's a teaching hospital. So the physicians who are supposed to be taking care of the kids are also training, and they have so many other responsibilities. And nurse practitioners became sort of a bridge where you had nurses with advanced training who, you know, we were in charge of the patient care, you know, from 7 a.m. to 7 p.m., 5-6 days a week. But I think just that role was sort of fixated on you just do patient care. I think it's expanded now to do, you know, to look at, like, even for me, like to be able to learn about genetics now at this point in my life. Like I feel like I'm constantly learning, and there's more reception for, well, an NP could do this, you know, like when things come up, people are more open to saying, well, a nurse practitioner could do this, a nurse practitioner could assume this role. And also even just in terms of recognizing how nurses work in management in hospitals, that nurses have a unique perspective of knowing like what happens at the bedside. Because I actually think being a bedside nurse is a really important foundation for nursing. Like I think there's so much, whether you do it, some people are like, oh, I only want to do it for 2 years, and that's fine. But I think you learn a lot about how to, like, not just empathy, because empathy is so important, but just how things run. You have to understand, like at the basic level, like in healthcare, like, you know, what it takes to get a patient admitted and discharged and how things run. So like, I think people recognize that nurses are at the ground, and so that when things expand or there's need to change things in institutions, nurses can really easily go in a variety of directions, whether it's management or expanding their practice level or creating new positions, or, you know, like I have friends who have gone from a bedside nurse to running clinical studies to like being like a director at Dana-Farber, you know, as a nurse, and they've been mentored through that role. Like they've encouraged them to get their graduate, you know, to continue their education. And I think people recognize that nursing, like there's a lot of multitasking. You bring a lot of talents into healthcare to learn how to run things and manage things, and just it seems more open, that your role is not so, you know, you're not stuck in one role as a nurse practitioner. It's not that this is the only thing you can do. There's a variety of things that you can do now, I think. I don't know if that, you know. So that's how I feel like it's changed from being just patient care focused to sort of more opportunities, but opening up for nurses to do more in healthcare, and the management of it and other aspects.
Right. Let's talk a little bit about the application process. And I realize that you may have applied a while ago, but I'm sure you have a sense of maybe what is it that admissions committees are looking for? What are the requirements for applying to a program? Those sorts of things.
So I think, so one thing to really consider is some schools, I think there's one girl who's in high school, right? Addie, was that one, the high school girl? There's a girl on who's So I think one thing to consider from like her perspective is that certain schools are direct admit to nursing, where right out of high school you get in, and then other schools, there's a lot of schools that are not direct admit anymore. You might, like for example, St. Louis University is a direct admit program. You get admitted into the School of Nursing as part of your acceptance process. But like Indiana University in Bloomington, who has a really great nursing program also, they're not direct admit. So you might get in there, but you don't find out until before your junior year if you're going to be able to get into the nursing program there. So that has changed because for me at least, because when I was applying to college 30 plus years ago, you applied to a college as a nursing major. So I would definitely weigh those things in terms of applying, whether it's a direct admit or you can get admitted later on as a junior as a nursing major. I think, my experience in seeing what kids bring to the table is really my most recent experience is I taught at St. Louis University for about 12 years as an adjunct faculty person. For the most part, those kids were pretty high achievers. Those students were high achievers, and they had to have express some interest, whether it was volunteering or doing something of that nature as part of their application process. Different schools have different levels of competitiveness, obviously. And also, like at SLU, just to use that as an example, their students, they're accelerated students. So students like, I can't remember the two WashU girls, but they're both psychology majors. I remember that. Like those students who applied after college, that's a very intense, you should really consider the intensity of the program should you choose to do that, because like SLU is a 12-month program. It's very, you really can't do anything else but go to school. They start in May and end in May. And some other programs have a 16-month program, which might be more manageable. I do think from all the accelerated students that I met over the years at SLU, that it was a grueling year. It was a really tough year in terms of, their classwork, their clinical work, and just, and a lot of them were older and had families. I actually don't know how they did it. The time commitment is enormous. But I think they were really good nurses when they were done. I think there's a commitment to preparing people to be very well-rounded. So there's different, I think Goldfarb, it's a little bit longer, like 14 or 15 months, which might be a little bit more manageable. And there's programs like that all over the country, those accelerated programs. I think the accelerated program is really intense, but I think most people who do that, like, they know that's what they want to do. They're not, they're 21 or older, and they're prepared for that year of intensity. It's pretty tough, I think.
Could you talk a little bit about the experience of NP school? What is it like? What did you find most useful? What did you find most challenging about that experience?
Sure. So when I went to NP school, I chose to do it part-time because I was working full-time. And I had to continue working at the time. So I definitely think if I could do it again, I would not have done it that way. I would have made some changes, like not bought a house and gone to grad school. So I didn't have a mortgage while I was going to grad school, because I think the experience would have been a better experience for me if I had been more at school more than I was at work. And for me, I was still working full time for 3 of the 4 years that I did it. There's a lot of, I think now, so my focus, I did a pediatric ambulatory program. So I was focused on outpatient pediatrics. I think that now there's more of a focus on research in terms of having writing skills and being able to participate in or conduct a research project. But I think the mentorship amongst faculty is pretty strong. So it's not like out of the blue you have to do it. I think there are people guiding you along that process. The clinical experience is there. I definitely would consider, when I looked at a school, how willing they are to help you find clinical placements. Some schools have clinical placements set up and they tell you, okay, these are people we know that will precept you, and every year they do this for us, they're willing to precept you. So it's not as difficult to find a nurse practitioner or a pediatrician, or if you do adults, an internal medicine person that will let you work with them for 160 hours at a time. But some schools, you're on your own and you have to find all your placements on your own. So it might be great if you're, if you're in St. Louis and you were a nurse at St. Louis Children's Hospital and you need to get clinical placements, but people there are helping you. But if you have no connections, and you don't have anyone to help you make those connections, it could be a little bit hard. So I would definitely want to know what their level of commitment is to helping you find those placements, because clinical placements in graduate school are really important in terms of giving you good experience that you can take with you when you're practicing on your own, and being with people who want to teach you. Because teaching somebody in graduate school, like a nurse practitioner student, is as a preceptor, it's a pretty intense process. Like, you're taking care of your patient, but you're trying to teach someone the whole time you're doing it. So you really want preceptors who want to do it. Like, you don't want to get stuck with someone who doesn't want you there with them. 160 hours is a long time. So the question I would have for the schools is how committed they are to helping you find those preceptorships, or or do they already have a network? Because that could sort of really make or break your experience, I think. If you're struggling, you need clinical hours, and if you're struggling to find people to give them to you. I don't know if everybody knows what clinical hours are, but that's like your actual, as an undergrad or as a grad student, that's your actual hands-on training time. As an undergrad, it's done in a group setting, or if you do an accelerated program, it's done in a group setting where you and 7 other students are with one instructor in a hospital setting typically. As a grad student, you're on your own. It's you with a preceptor, doing clinical hands-on training.
Okay. Let's get into the day-to-day experience, or if it's, a lot of times people will say, no day is the same. So if no day is the same, a week in the life of a nurse practitioner, what is it that you're doing on a day-to-day basis? What percentage of time are you spending in different activities? What medical, non-medical skills you're using? Give us a glimpse into your week.
Sure. So I have two so your role will always differ depending on what your role is. So I'm going to talk a little bit about what my day-to-day life was like when I did the Down syndrome clinic at WashU. Because that was a more clinical patient-based experience. So there I worked part-time, I worked 24 hours a week. So 3 days a week, and every day I saw patients in clinic. And so typically about 2/3 of my day, I saw patients. So I followed children's, newborn to young adulthood with trisomy 21. And a lot of, I would see those patients in clinic. The clinic was, each clinic visit in that situation was about a 45-minute clinic visit, because we sort of covered the whole gamut of, not just health concerns, but developmental concerns, social concerns. And I would spend about 45 minutes with each patient, and I would probably spend an hour after they left, either that day or on a subsequent day, going over their labs, their test results from that days, and doing a lot of coordination with other specialty services. Like, for example, I might see a 4-year-old in Down syndrome clinic and spend 45 minutes with the family and, order labs that we would do as part of our routine screening. And the next day I'm talking to an endocrinologist about abnormal labs and setting up follow-up for that patient, and then calling the family back, going over the plan with the family and talking about that. So I would say that role, about 60% of my time was face-to-face time with patients, and 40% was behind-the-scenes time or follow-up time. So that was a moderate clinically based role. Currently, my role now, and of course because of COVID, it's all changed. But even before COVID, I'm only a half-time worker here in Boston. I work 20 hours a week. And my role is really more of an office role. I spend a lot of time talking to families. Like, we'll get referrals because there's a sudden death in the family and we're trying to figure out, and we would call that person the proband, the person who died suddenly. And if we think there's a genetic cause to it, and then figuring out who else needs to be seen, what's the other family history, getting outside lab testing, coordinating them coming in for echoes, EKGs, and then subsequently seeing them in person. But really, less than half of my time currently is face-to-face with patients. So it's, your role can be very different. Like, if you do primary care or work on an inpatient setting in a hospital, that's 80% of your time is face-to-face with patients. So I honestly think as a nurse practitioner, it's probably a good idea that you spend more time in the beginning face-to-face with people.
Okay. Are there any myths or misconceptions people have about this role?
I think sometimes people will say, oh, you're just like a doctor. And, you know, I don't think that at all. Like, I've never thought I was just like a doctor. I've always thought nursing was very unique and in its own way. I'm married to a doctor. I think what he does is very different than what I do. And I think that's one of the things I loved about nursing. Like, you get to know families and spend a lot of time with them. And I don't like that you're like a doctor perception, because I feel like we get to do a lot more comprehensive sort of holistic care with families. And I think doctors have different pressures on them, and their role is totally, it's different. But I also feel like I've been very fortunate, and I think this is key if you decide to become a nurse practitioner, is to choose jobs where you have good physician support. And by support, I mean people who recognize, like, who want you to grow and learn the role, and people who are there. You know, I've been doing this for 25 years. I mean, just this morning, I said at 7 a.m., I sent an email to my boss saying, you know, this is what I'm thinking with this patient. Do you agree? Do you disagree? Because I recognize I'm constantly learning. And I feel like that's always been a key thing for me, that I've had physicians, you know, I've been lucky to choose jobs where physicians recognize that that's their role, and that works hand in hand with my role. And I think that's a critical thing. I think there are some nurse practitioners who are like cowboys and, you know, like the comparison, but that's just not me. I've never thought I was a physician. You know, that's probably not, some people probably wouldn't like it that I said that, but it's just a very different role.
Mm-hmm. So you just talked a little bit about some of the differences between being an NP and a physician. How is the role different between being a nurse and a nurse practitioner?
Well, I think you have more autonomy when you're a nurse practitioner. You have different responsibility. There's more, I think being a nurse, like a staff nurse, prepares you well, because you really learn a lot of the multitasking and organizational skills that you need. Like, I was a staff nurse like for 6 years on a floor before I became a nurse practitioner. And I have to say, I felt better prepared for the NP role than colleagues of mine who worked in an ICU as nurses and then became nurse practitioners, because you really have to know which area you like. Like, I like being an ambulatory outpatient person versus being in acute care. Like, you can become a nurse practitioner and work in an ICU, then you probably need ICU staff nurse experience. But I think if you want to do the outpatient world, you definitely need inpatient experience that's not so intense. So I think nursing organizational skills prepare you to be a nurse practitioner. You have more responsibility as a nurse practitioner, but more autonomy. You know, you have your own patients. And you do a lot of teaching as a nurse practitioner. So if you like teaching, I think it's a natural transition from being a staff nurse to being a nurse practitioner, or even people who've gone from staff nurse to nurse educators, because you get to be a nurse and you get to teach. So I think there's a combination of roles that way.
Okay, I'm going to ask one final question before I turn it over to the students to ask questions. What would you say are the things that are most rewarding and most challenging about being a nurse practitioner?
I think, well, for me, the most rewarding things are, I really feel like I help people, and that I've been privileged to be, even though some things are very sad, like I feel like I've been privileged to be a part of people's lives, even in like very sad moments in their lives, like, you know, the loss of a child, which I think is the saddest thing that could happen to anybody, you know, like, but I feel privileged to have been a part of that and been a part of people's lives for that. And also just to be able to help them. Like for me, like my work in the Down syndrome clinic, I felt like it was such a rewarding experience for me because I didn't know it would be like this for me, but I loved the kids. I loved the families, and the community in St. Louis was incredible. Like there's so much support for families. I was fortunate. Like I was just in the right place at the right time. And I feel like those kind of rewards are things you can't get in every job. I think that the challenges of being a nurse practitioner, and I think this is a real challenge. I think the training, like the education, could be more. I feel like we don't get enough medical training in terms of like managing disease and illness. And I think the way I worked around that is that I tried to find jobs in the beginning where I would learn a lot of medicine, like being inpatient, or my first job in primary care. I had a close relationship. The pediatricians worked hand in hand with us. So it was a job where I could learn a lot, but definitely grad school, like nurse practitioner school, I feel like you don't get, it's fast. You don't get as much time as you probably need. But I think you can remedy that by choosing wisely on your first jobs, to be honest.
Okay. Well, now I'm going to turn it over for audience questions, and I'm comfortable with you using the chat function, electronic hand, physical hand, or just stating your question. So, are there any questions? Go ahead, Matt.
Hi, I like to ask all of the nurses who I talk to this question because it comes up so often for students at WashU. They have a nursing program, so they're always going on to accelerated programs afterwards. Can you speak about what you see as pros and cons of an accelerated BSN as opposed to an accelerated MSN?
I think the biggest pro for an accelerated BSN versus MSN is, and I could be wrong with this, but I think in a BSN program, you get more staff nursing training, like as a staff nurse in a hospital. And I actually think that's a really important role that all nurses need to have. You don't have to do it for 10 years, even if you do it for 2 years. I think amongst nurses, there's a wariness of people who have never worked as a nurse on a floor. I mean, even like just now being back in Boston after 15 years, there's a lot of new people there. And I said, I asked about someone the other day, and someone was telling me, where they came from. And the second thing they said was, she never worked as a staff nurse. And so I think that I understand the allure of going right to an MSN program, but I think there's invaluable experience to working as a staff nurse, to understanding. It's a really hard job, and just to understand what nurses go through day to day, especially now. I can't imagine what it's like being a staff nurse in a hospital, but I get why people want to do the MSN, but I think being a staff nurse is really important.
I've heard that as well. One other thing that I've also heard is that it's very difficult to know what kind of advanced specialty you want to get into until you've actually spent some time on just being a staff nurse.
Yeah.
A friend of mine said that she loved children, but then whenever she would go into a labor and delivery, she'd start crying because she was so happy. And she upset the parents. And then she realized she had to take care of sick kids, and that was too upsetting. And she realized she could never be a pediatric nurse, even though that's what she thought going into it. And so she chose a different profession altogether, like a different area of nursing. That's
so true. Yeah. I thought I was going to take care of old people. I thought, I'm going to take care of old people when I was like right before clinical. And then the first time I did, I was like, oh my God, I could never do that. Like within a day, I'm like, nope, not for me. Yeah.
I feel like the accelerated MSN might be a very tall ladder, but if it's up against the wrong wall, then you're in trouble.
Yeah, I think it's a tough. I know people do it. I just think you have to know what it's like to be a nurse, like to run around taking care of 5-6 patients, and to see honestly, sometimes it's the beginnings and ends of life, and that's and it's hard, but I think that's how we grow. I don't know. I know people don't like that, but.
Thank you.
Sure.
All right. There are a couple of questions in the chat area. I'll read the first one.
Okay.
All right. What are some
Oh,
paths?
I see 'em.
Oh, can you see it?
Yeah.
Okay.
So what are some ways, okay, so we went to pediatrics, and what are some of the things you do as a pediatric nurse? Oh, so I think, so you can either get into pediatrics, like if you're lucky, right out of college, where you get hired on a pediatric floor. A lot of times getting a job in a pediatric hospital has become increasingly difficult. So one way for sure is if you do nursing, to really make sure that your pediatric clinical instructor knows you well, and he or she will write you a letter of recommendation. A lot of pediatric hospitals will hire people who have done clinicals at their hospital, but they want letters of recommendation from their nursing instructor. So not the person in the classroom, but the person who spends 12 weeks with them on the floor. And then I worked as a pediatric nurse practitioner in cardiac surgery. I think that might be the second half of the question, and correct if that's what it's referencing.
Pediatric nurse surgeon is the terminology that's used.
Yes, so I think that's the. I think that's what the question referenced. But so what I did is, as a nurse practitioner for pediatric cardiac surgery, once the kids came after open heart surgery, came out of the ICU onto the floor, we managed their. You needed a master's degree. I got that after I got my master's at BC. We managed the kids on the floor in terms of like weaning them off meds, weaning them off oxygen, ordering appropriate tests, whether it be chest x-rays, EKGs, echocardiograms, getting them ready to go home. Kids after open heart surgery have these things called chest tubes, which are big plastic tubes that sit in the lining of your lung, and these little pacemaker wires that sit on the top of your heart. We would pull those out. And we always had a physician around if we needed help, but we would manage them with the nurses on the floor. And instead of residents, like medical residents, the nurse practitioners, we managed the day-to-day care of the floor, wrote orders, wrote discharge orders, updated the surgeons daily. And so the training for that was really having pediatric nursing experience, bedside experience, and having a master's degree. And then should I go on to the next question?
Yeah, the role of an NP. What's the difference between the role of an NP and a physician assistant, and what are some examples of roles that are carried out by an NP but not a PA?
I think, so from my understanding, the roles are very similar. The one big difference that I've always thought and heard, some of it is geographic. PAs are very big in California. I think, I'm not sure if that's because there's a lot of programs out there, but there are a lot of PAs in California. And the other big difference that I've seen personally is a lot of PAs have operating room experience and work as first assists for surgeons in the OR, if that's what you want to do. So just to understand the sort of, as physicians train, attending physicians who are done their training, often in teaching hospitals have residents, fellows, then residents underneath them. But because of physician shortages, you can't always fill those slots with physicians. There aren't enough physicians training to fill those slots. So in lots of places around the country, programs have hired PAs to be sort of like their full-time fellow. Like they're always in the operating room with the surgeon. I feel like it's a more of a clinically based practice, a skill-based too. And that's the big difference. Although I think for most things, PAs and NPs do the same. Like I don't see a lot of NPs in the OR, but in the rest of the medical world, inpatient or outpatient, I think physician assistants and NPs are pretty similar. I know the PA program is, I don't know what you do after an undergrad. I don't know how many years is it after an undergraduate degree. I don't know if it's another 2 years, but for me, I didn't want to do that because as I am a worrier about many things in life, I always knew that if I had an RN, I would always have that to fall back on because, in my paranoia about always being able to have a job, I knew that if I was a nurse practitioner, I was also an RN. And so no matter what, I could still work as an RN. But that's just my paranoia.
Perfect. And then Matt has added, or Dean Duvall has added some additional information to the chat for you all.
Okay.
Are there any other questions? Okay. It looks as though there are none. Are there any final words you'd like to share, Kathleen?
I think, you know, I hope people choose things that, I mean, make them feel as lucky as I've always felt. I mean, I really honestly have always, even on the worst days, have felt lucky to do what I do, and have been really, another important thing, have been really fortunate in the community of people that you work with. And you know, it's like a work family, and in nursing, and I'm sure for physicians, it's the same way too. That family is very important. And I feel like, it's such a wonderful, like, I feel like I've been brought up by all those people, and I hope I continue to bring people up as they come into this role. And I'd be happy to answer, you know, if anyone ever has questions in the future, I'm happy to talk to anybody about it.
All right. Kathleen, thank you so much.
Sorry, I was
spending
late.
Time with us, and thank you
Oh,
to
sure.
all for coming, and for the students who participated. Oh, there's one last question. I'm wondering if you could talk about, I can never say the word, nurse anesthetist,
Yeah,
role,
you got it.
education, that sort of thing.
Yeah, so actually, you know, that's a great question. That's a very interesting role. There's actually, I think one of the best programs in the country is at Goldfarb School of Nursing. It's in St. Louis. They have a great nurse anesthetist program. And so nurse anesthetist, typically though, the prerequisites for that, I believe you have to have ICU experience as a nurse. And I think people who love ICU nursing, it's a great role for them. There's a lot of autonomy. I think that's a fascinating role. And I think if you, in terms of like knowing there'll always be a job, I think that's a role that will only has more security going forward, because there's a lot you always need people who can do anesthesia. And I think if people are seriously interested in that, like it takes a long time, especially if you have to go, do an accelerated program and work for a couple of years in an ICU. But I think that's a fabulous job. I think it's very you have to be really, obviously excellent with math, because you have to do med calculations on the fly all the time. But I think for people who like ICU nursing, it's a natural transition over to that. One of my very good friends from college has been doing that for 25 years and loves it. So.
Okay. And did you mention the education that's required? I may have missed that if you did.
Yeah, it's a master's program. It's a CRNA program, Certified Registered Nurse Anesthetist program. You can do it at lots of places that have grad schools for nursing, but I'm pretty sure Goldfarb in St. Louis has one of the best CRNA programs. They're really highly ranked. And so you have to get your bachelor's degree, your RN, and you almost for sure have to have, I think, 2 years of ICU nursing. I don't know if they take ER nursing, but I thought you had to work in an ICU to apply to that program.
Okay, we have another question. If I'm considering ABSN or MSN, what are some paths that can lead to pediatrics? For example, how would an RN be able to work in pediatrics versus someone with a MSN degree?
So if you're an RN, anyone who's an RN would be eligible to be hired as a staff nurse on a pediatric unit. I think because those jobs are so competitive now, getting jobs in pediatric hospitals, it would be definitely worth your while to somehow distinguish yourself, whether it's volunteering or making sure, you have these things in college when you get your RN that you think they're called special preceptorships. Like I know for at SLU, like kids who wanted to do their independent practicum in pediatrics were like the top academically highest ranking kids, because there are so few pediatric slots. So before they graduated, they wanted to do an extra pediatric clinical. But I think like showing an interest, obviously having good grades or volunteering. So when you're an RN, you can get a job as a staff nurse in a hospital. I think getting your MSN you'd have to do the RN MSN program, obviously, to get your MSN. But to get hired as a nurse practitioner without pediatric experience, I think is more challenging. I think that I don't know what nurse recruiters in pediatric hospitals would think of hiring a nurse practitioner who never worked as a pediatric nurse. I think that's a little bit harder. So I definitely think that getting the RN first gives you the opportunity to get bedside clinical nursing experience as a staff nurse.
Okay. Final call for questions, since those two came through. after we thought we were done?
Oh, fine. I was late.
Oh, that's okay. All right. So it looks as though that's all of the questions. So I'll give you one final chance if you want to say anything else, Kathleen.
No, I'm good. I appreciate all your time, and I apologize again for being late.
No, that's okay. It worked out. This is great. I think everyone appreciated what you shared. We had a lot of great questions. Everyone seems engaged. So thank you so much, Kathleen. And thank you all to the students who participated. I'm glad you had a chance to meet Dean Duvall, who can assist you with your pre-nursing path. All right.
Thanks.
Bye, everyone. Have a good
Bye.
day.
Thank you.
Thank you.
Thank you.
Bye.
Okay. I think that went well.
Yeah, very well. I'm glad that you were able to track her down. I think it was very helpful.